A doctor from Leeds has developed a new piece of surgical equipment for treating patients with a shoulder injury that can cause chronic pain.
Roger Hackney, who's also a former Olympic athlete, helps design a new type of patch that can fix large tears in a group of muscles and tendons surrounding the shoulder joints.
Our health correspondent Jamie Coulson has been to the Spire Hospital to see how it works. Now his report contains scenes of surgery.
It's pretty bad today, because I haven't had any painkillers.
74-year-old Becky Horsfield has suffered agonising pain in her shoulder since having a fall last year. She has a large tear in an area called the rotator cuff, which means some movements are almost impossible. But today she's having surgery to try and fix the problem.
Getting dressed is impossible on my own. I have to have help with that. Putting anything over my head is impossible, so everything has to button up the front. But the pain is very severe. It goes down the arm, all across the shoulder blade at the back, and it actually goes up the neck behind the ear.
That white stuff up there is the rotator cuff, and you can see it's ragged and torn.
The size of the tear in Becky's shoulder means that traditional surgery would be difficult with a limited chance of success. So she'll be relying on a piece of equipment that's been developed by a surgeon from Leeds who wanted to improve on existing technology.
If we can have the lights on.
The rotator cuff is a group of muscles and tendons that attach to the bones of the shoulder joint. Now, tears can develop as a result of age or an injury like dislocation. Now, a Leeds surgeon has developed a technique to treat large tears using a new type of patch made out of polyester fabric. The tear is repaired as far as possible using stitches before the patch is secured over the top, reinforcing the repair and offering a permanent support.
So I'm just doing some tidying up sutures now to make sure it sits nicely.
In just under an hour, the operation is complete and the tear in Becky's shoulder has been fixed.
She should get good return of function. Now, she may not get full overhead activity back, but she'll lose her pain and she will have an excellent range of movement.
Well, I couldn't bear the thought of life as it was, to be honest. You know, pain night and day and not being able to do things. At least with this, I've got some hope.
The patch is already being used in a number of European countries, offering patients like Becky a solution to a painful problem. Jamie Coulson, BBC Look North.
A £30 million police training centre has opened in West Yorkshire. The giant